Now for part 2 of psychological health. I just want to say at the beginning, and you've probably noticed it by now, but I've been using the word mental health and mental disorder and psychological health and psychological disorder interchangeably. We're going to look at different types of disorders, how to treat those disorders. We'll discuss what we'll be doing in class. The different types of psychological disorders we're going to look at are cognitive and anxiety disorders, as well as mood and psychotic disorders. Cognitive disorders are caused by acute damage to or chronic degeneration of the brain. These disorders include dementia. The most common form of dementia, and the one that we'll be discussing, is Alzheimer's disease. We'll also be discussing Parkinson's, and another cognitive disorder that we're not talking about is amnesia. In Alzheimer's disease, there is a problem with what are called nerve tangles and deposits in the brain cells. If we look on the left, if this is a nerve in the brain, and this little tiny part are what are called neurofibrils. We're just going to call them nerve fibers. What you can see is these are nice straight lines, nice straight fibers. However, in an Alzheimer's patient, the brain cells look like this. There are tangles, there are deposits of what are called amyloid plaques that causes a disruption in the fibers, and that leads to an inability of the brain to transmit those nerve impulses and to send those signals and neurotransmitters. On the left is a normal brain. This controls language. This segment controls memory. In an Alzheimer's brain, due to the damage of these nerve fibers, there is a profound difference in the language and memory centers, leading to the changes that are associated with Alzheimer's disease. There's no known cause, and as of right now, there's no cure, but there are new drugs. The FDA has currently approved 5 medications that may delay onset and temporarily relieve symptoms associated with Alzheimer's disease. In class, we'll look at this rather powerful and personal story as one man chronicles his father as he progresses and eventually dies from Alzheimer's disease. In Parkinson's disease, what occurs is a decline in the production of the neurotransmitter dopamine. Most cases have no specific cause. Some causes, however, may include head trauma, use of drugs, toxins, something called anoxia, or depriving the brain of oxygen for a long period of time. Without treatment, patients become rigid, they have problems with speech and motor skills, they have tremors. Perhaps you've watched Michael J. Fox, you've seen him on television. He has become a spokesman for Parkinson's disease. On the right, the book, The Case of the Frozen Addicts. It describes the story of how in 1982, suddenly in emergency rooms throughout the Los Angeles area, young people were showing up, frozen. They were unable to move, and what they apparently all had in common was the use of a synthetic heroin. They're called frozen addicts because all of these tests were being done on them in the emergency room. They were being poked with needles, they were being prodded, looking for some type of response. There was none. And what is awful about Parkinson's disease is that while on the outside they appeared frozen, on the inside they were able to feel everything. What resulted from this horrible tragedy, however, was the development of an animal model that allowed scientists and doctors to study how Parkinson's affects the brain. The Case of the Frozen Addicts, a phenomenal reading. Anxiety disorders occur in over 19 million Americans. Sometimes you may have what you may consider to be a panic attack. You have a rapid heart rate, shortness of breath, you may feel dizzy. It's not considered a disorder, especially if you're able to associate it with a specific event. However, when these panic attacks begin to occur without any apparent cause or reason, then your panic attack becomes a panic disorder. Anxiety is an emotional state that's characterized by feelings of nervousness or tension or a sense of apprehension. Phobias are considered anxiety disorders. An individual may be considered agoraphobic when they are afraid to be out in public, or actually what it means is fear of developing an anxiety attack. What happens is over time, these people won't leave their houses because they're afraid of becoming afraid. Claustrophobia is fear of being enclosed in places. This one is arachnophobia, or fear of spiders. I put it in here because I have two sons, not small children anymore, who have an amazing fear of spiders. General anxiety disorder, in which an individual experiences excessive worrying, excessive to the point where they are unable to perform any tasks of daily living. And obsessive compulsive disorder. Perhaps you know of individuals with OCD. Perhaps you think you have certain obsessive compulsive type behaviors. Well, some of these behaviors include a need for perfection or symmetry, sorting or counting. The individual with this type of OCD is always making sure that things are in groups of 5 or groups of 6, or sometimes they're just counting on their fingers. They need to make sure that they've counted up to a certain number before they're able to proceed with any other activity. They also have an obsessive belief in magical or superstitious thinking. This picture on the right, can't step on a crack in the sidewalk. They will avoid sidewalks in order to avoid the cracks. Individuals with OCD have obsessive rituals. They may be obsessed with washing their hands, with checking and rechecking locks or stoves or lights. In the movie As Good as It Gets with Jack Nicholson, we'll watch a clip of it in class that shows the behaviors that he exhibits that are a part of his obsessive compulsive disorder. The most common type of psychological disorder is also the most common type of mood disorder, which is depression. Is prolonged feelings of hopelessness and worthlessness, along with periods of sadness. Now, what I must tell you right now is that there's a difference between being depressed and experiencing depression. You certainly may have experiences in your life about which you are depressed, but when you are experiencing prolonged feelings of hopelessness and prolonged feelings of worthlessness, you may be developing a depression. An example may be viewing life through blue-colored glasses as opposed to the optimist who views life through rose-colored glasses. Mood disorders may be a combination of genetic and environmental factors, and this goes back to what we talked about previously as the diathesis stress hypothesis, that you may have a pre-existing genetic vulnerability and you then experience some type of stressful situation in your environment that triggers this mood disorder.